Hi, I'm Rob Kitts. I'm a psychiatrist and child psychiatrist in Cambridge, Massachusetts. When I meet with patients, I really like to get an understanding of what's going on, and I really spend a lot of time trying to understand and best figure out the solutions. So when I do meet with them, I will talk with the therapist, have a good collaborative connection with them, and really work closely because I understand that it's an important decision to decide whether you're going to start a medication or not. And I really emphasize a holistic approach. So when I mean getting to know you well, I really want to know 360 in terms of how you eat, how you exercise, how do you take care of yourself. I'm open-minded to alternative approaches and really understanding what you need the most, whether it's sleep, it's a psych medication, really talking about meaningful relationships and activities, but really finding what's the best thing for you and not just medication. So I often work with people with anxiety, depression, often it's with college and graduate students who are struggling with work and balance. Often it's burnout. I also work with a lot of people who struggle with anxiety disorders. And one of the important populations that I work with are the LGBTQ population. I've been very passionate about that since medical school when I realized there was just a lack of need for really a respectful physician to work with the LGBTQ plus population. In knowing how important it is for people to, when they start a psychiatric medication, I really want to take my time. I don't want to be that prescriber that makes you feel like, oh, 15 minutes and you really don't know me and you're making a recommendation. I really want to get to know you, spend the time, and let it be a joint decision. With regards to my approach in therapy, I've had 5 years of therapy training from CBT to DBT to supportive therapy. I'm not an expert in one particular treatment, but I like to think of myself as a therapist with multiple things on his belt. And I really try to get an understanding of what the patient needs at that moment in time, whether they need some supportive therapy, whether they need to explore insight-oriented psychodynamic psychotherapy with regards to their relationships, or even whether they need to talk about exercise or yoga or what's meaningful for them. It's based on what they need at that moment in time. I've always wanted to be a physician since middle school. I wanted to work with adolescents and kids all my life. I really believe in providing and supporting youth and young adults and empowering them and really creating an environment that really makes them have a much more likely chance of being successful in life.